Hello, and welcome to Locate Guernsey's Healthcare Deep Dive, which is part of our Winter Virtual Event series. My name is Jo Stoddart, and I'm the Director of Locate Guernsey. We're a Guernsey government-funded agency whose role is to promote the island as a destination of choice for individual and business relocation. We provide free guidance, information and assistance to individuals and businesses who are considering relocating to the island. Understanding how the healthcare system works is very important for anyone thinking of relocating to a new jurisdiction. As Guernsey is not part of the UK's National Health Service, it's helpful for people to understand not only that we have excellent healthcare provision on the island, but also how that system works. All three of our panellists are doctors who have relocated to Guernsey, and they will be discussing not only how our primary and secondary system works, but also talking about the benefits for them as medical practitioners, and how Guernsey's setup allows them to provide such a high standard of care to islanders. They discuss the links which our hospital has with other specialist centres in the UK, and also discuss the job satisfaction which Guernsey's healthcare system offers them as clinicians. This deep dive is supported by the Island Health Medical Practice in Guernsey, to whom we're extremely grateful for not only providing us with financial support, but also for freeing up two of their doctors to be on our panel. Before we start the panel discussion, here's a brief reminder of some of the advantages and delights of Guernsey. I'm joined today by Dr. Robbie Hanna, partner at the Island Health Medical Practice. Robbie's a busy man. In addition to being a GP, he's also involved with hospice work in Guernsey. He's also leading the practice's project to develop a new surgery. And in addition to that, he's co-founder of a UK and Irish pharmaceutical distribution company, which originated and has its headquarters in Guernsey. I'm also delighted to welcome Dr. Duncan Watt. He's a GP at Island Health and relocated recently to Guernsey with his wife, who's also a GP and a Guernsey girl. And our third guest is Dr. Steve Evans, a wonderful Welshman who's lived and worked in Guernsey for 20 years along with his wife and sons. Steve is a geriatrician and general physician, and he's chair of the Department of Medicine, which provides most of the specialist medical care and surgery carried out at the Princess Elizabeth Hospital. He also coaches ladies rugby, so they're all busy chaps. So it's obviously important for any relocator to realise that there is no NHS in Guernsey, unlike in the UK. However, the island does have an income-related social security scheme, which islanders contribute to, and this covers some of the cost of healthcare. So, Robbie, how is Guernsey's medical system structured? And from your perspective as a GP, how does the primary care function in Guernsey?
Yeah, so as far as primary care is concerned, I think people locating here maybe would see some familiarity with traditional British general practice. However, there's some important differences. Practices are much larger. Our practice at Island Health is over 20,000 patients. But that means that we've got some scale and that doctors have their individual interests. We provide a wide range of services. I think the one thing that people may recognise that is different is that you have to pay A lot of patients choose to insure themselves as you would in any other aspect of your life, and there's plenty of insurance choices available. Primary care is independently funded, so the GPs essentially run and organise their own businesses, and there's actually some advantage to that in that we're not bound by red tape and a lot of bureaucracy that perhaps has bedeviled some of the UK general practices.
Okay, that's very interesting. So whereas the NHS pays for everything, what's it going to cost me if I need to go to the doctor in Guernsey?
The states do give a small co-funding, but I expect it to pay about £52 for a consultation. Now, consultations are normally longer, I would say, in Guernsey. We try to deal with a lot more. We offer same-day appointments, which I think is a big advantage, and they're face-to-face. The other kind of old-fashioned or traditional side of general practice here is that we pride ourselves in continuity. So if, for example, if somebody wanted to see Duncan will endeavour to provide that service for them. So I think that's something that's perhaps been a little bit lost elsewhere. We have obviously a very extensive nursing services, but again, the patient needs to make provision to pay for those. Outside that, it's really like a polyclinic. We've got other services, so things like chiropody, all the physical therapies, osteopathy, chiropractic. We've got a lot of other, I think we're focusing a lot on mental health, and so we have psychotherapists and psychologists all within the one building, so we can inter-refer. If you do require secondary care, we've got the very able services of the medical specialist group, and Steve is going to talk about that. So access to the medical specialist group is through GP referral.
Right, okay, thank you. So, well, Steve, cutting to you then. Tell me about the secondary healthcare. Tell me about the MSG and how the secondary care is organised in Guernsey.
Secondary healthcare, interestingly, is free at point of use, but in a similar way to the GP practices. The MSG is a private organisation, and we have a contract with the States of Guernsey to provide secondary healthcare free. So once you've seen your GP and be referred in, then from there on, the majority of services are free. We do offer private services over and above what's available on the contract with the state. And we offer most services. There are some very specialised services that we can't provide on island, so invasive cardiology, neurosurgery, but we do have good links with both London, Southampton and other centres in the UK to provide those services that we just don't have the numbers to manage on island. The MSG is a group of, is a partnership. There's 50 consultants and we employ about 150 staff, so we're quite a big organisation within Guernsey. We cover most specialities apart from emergency, A&E emergency care, psychiatry and pathology. They're provided directly by the state. The one difference you will notice when you come to Guernsey is there are no junior or trainee doctors, so all the services are provided by specialist consultants, which means that whether it be emergency care or whether you come to clinic, you will see a properly trained specialist doctor with lots of experience, and they'll see you every clinic visit. So I think that's a major plus. The other thing is our waiting times are significantly less. The contractual waiting time is a maximum of 8 weeks, and even allowing for COVID, we're still meeting those in most of the specialities. I think some of the surgical specialities are struggling, but that's because of access to beds and the backlog, because we weren't doing any elective work over COVID. So I think it's recognisable, both primary care and secondary care. I think the system works really well together. I think the relationship between primary care and secondary care is generally very good. And if people need to be seen, they can be seen pretty quickly, really.
Oh, that's wonderful. Thank you. So now, Duncan, you're a relative newcomer to the island. Yeah. So although your wife is local, you've been through the relocation process recently. Tell me about your impressions of Guernsey and how does the quality of life here compare with other places that you might have lived in?
Well, I probably first knew about Guernsey maybe 5 or 6 years before we moved over here, and it was pretty obvious when we did come for a visit, because as you say, my wife's from Guernsey, that it was a lovely place to come. So the initial impressions were small but not too small of an island, all the provisions you'd want in a jurisdiction of this size, great outdoor lifestyle, you know, it's very easy to sell the actual living side of the island, and you know, we've been here 4 years now, and we have no intention of ever leaving, really. In terms of relocating across, actually, we found it quite straightforward. There's buying the house or renting the house, which in initial phases can be a little bit difficult with viewings. I know certainly at the moment the housing stock's not great, but that's a lot because there's been an influx of people coming in through COVID. There's obviously the practicalities of moving to the island, making sure that you set up with a local GP, which, as Robbie alluded to, the access to care is pretty good, so you can just register and get going, setting up social security, that type of thing. But by and large, it was pretty much friction-free moving to the island, and certainly not one with any regret.
Oh, that's super. And so how does your experience as a GP here compare perhaps with your work in the UK?
Very different. The actual type of medicine, seeing the patients, the appointment provision, very similar, but everything else, I would almost call it chalk and cheese. I found myself leaving a job in the UK that was quite busy, overworked, and felt that we weren't always giving patients what we needed, to providing a really good level of care and a very good access of care in equal measure. And that makes for a very enjoyable career as a clinician on the island. I think that goes for pretty much all the other doctors here as well. I
think anybody who has a concern they're leaving the umbrella of the NHS, you know, into the unknown. They'll see a very familiar system. All of our doctors are UK accredited. We're regulated by the GMC, and the way we work is very familiar. It's the accessibility, I think, is a big thing. One thing we ought to mention is accident and emergency.
Yes.
And we really have, we've got St John Ambulance and Rescue, and that is absolutely fantastic. And we've got a great accident emergency with a qualified team. You do have to pay for that, or you have to make insurance provision for that. But so if you have got health concerns and you're thinking of relocating, by all means, speak to somebody here, and we'll be happy to talk. But as Steve says, we've got great links with university hospitals across the UK.
No, that's brilliant, actually. So, and you say that there's a good range of specialists available on the island. You've got specialists for most categories.
You know, the MSG, we've got 50 consultants, might be 51, across a range of general medicine, surgery. We've got oncology services, ENT, paediatrics, women in obstetrics and gynecology. So we cover a broad range. We've got intensive care as well, and the intensive care unit has done very well in audits, comparing us to national, taking part in a national audit in the UK. So I think the level of service that we provide, even though we're in a small unit, is comparable with services, if not better than services you'd get in the UK. You know, we provide, I suppose the easiest way of describing it is like a district general hospital, which would generally cover a population of 250, 300,000, but we supply some add-on services as well. So we're like a DGH plus for a population of 65,000, and the access is easier. The funding arrangements are slightly different, but I think on a day-to-day basis, you wouldn't notice the way those funding issues apply to the care that you receive. And the physiotherapists are a private organisation as well. But I think if you came onto the ward, you'd be hard-pressed to identify who was an MSG employee, who was employed by the physios, and who was employed by the states. We work together really well as a team across primary, secondary, and the tertiary care centres in the UK. So even people with, rare sort of diseases that would be referred on to a tertiary centre in the UK have good care, even if they are Guernsey-based.
The two things that people want from healthcare is good access and good quality. And without doubt, that's something that Guernsey can provide.
That's wonderful, actually. So what about things like maternity care? How does that work?
We've got a team of 7 obstetricians and gynecologists, and they work closely with the midwives and with primary care. And the majority of obstetric care would be midwife-led, as long as it was, without any problems. And then if problems develop, it can be escalated to consultant care. And if on the rare occasion where support is needed, then our department has got very good links with the services in Southampton for the occasional pregnancy which is problematic, and the same for neonatal emergencies. So that, and again, there are good links off island and a good link in with primary care for aftercare, well, for prenatal and postnatal care. So I think the system works.
Yeah, we're happy to share care with our specialist colleagues. Also, we should mention paediatrics here, so locators might have young children. So through primary care, we've got some individual specialisms within primary care, and we've got an excellent team of paediatricians. There's also very good community paediatric care, and that's organised by the States of Guernsey. So we have access to specialists in autism and some, obviously, mental health, etc. So that is something that's worth mentioning, because it is something that is provided for, even on a small island. I really think we punch above our weight.
Probably just adding in my own personal experience as well, when you're asking about maternity care. So we've been here 4 years, and during that time we've had a family, we've had 2 children on island, and we've experienced it as service users as well. And we can't fault it. We had a great experience with our midwives, actually seeing the same midwife all the way through, although I'm sure it's not guaranteed, worked really well for us. And yeah, we had to have a little bit of intervention with some doctor input towards the end, and having that top level consultant was great.
Fantastic. That's very reassuring for people to know. And what about holistic and alternative treatments and care? Is this something that either the practice provides, or are you aware of other service providers in Guernsey that can offer that?
Yeah, well, if you're looking at sort of paramedical services, we've got those all within house. If it's moving outside, sort of more alternative complementary practitioners, there are plenty of independent practitioners here. And if you just need to look online and see what service you require. I think the big thing about our services, both primary and secondary, is that it's externally scrutinised and it's regulated. So we pride ourselves that we are more than up to the standard of the UK here. So you're not necessarily coming to an isolated place where it's a Wild West. We're all very much regulated, and we ourselves have got CHUCS accreditation, which is a very high standard that we work to. So that is something I think that we work hard every day, every year to achieve. And we're always looking for innovation. And also innovation is easier because we're nimble, because we don't have a great big management structure sort of on our shoulders. I don't know what it's like in the MSG.
I think it's the same. We're say 50 doctors. We have a contract with the states to provide services, but generally introducing new services or is relatively certainly easier than my NHS experience of 20 years ago, and from speaking to colleagues that are still within the NHS, trying to get a new service through, there's multiple hurdles. Whereas I think here with working in conjunction with the GPs, working in conjunction with the states, because we are relatively small, things are relatively easy, and you often know people. I've been here 20 years, and I think you build a rapport with primary care, with tertiary care, and that makes practicing medicine, it sort of oils the wheels, if you like. So you're not speaking to a faceless person who you may never have met before. You know someone, and you've built that rapport and trust with them, and does that make sense? And the working relationships are much easier because we're small, and you tend to know most people, and I think that makes a massive difference, rather than being in an organisation that employs, a couple of hundred doctors and other staff that you may never have met. And when you're making a referral over the phone, you've then got no idea who you're speaking to. Whereas, if Robbie rings me, then I know who's on the end of the phone, and I know, I know where his level is, and if Robbie's having a quiet little internal panic, it's. Do you know what I mean? Sometimes it's difficult to judge whether something really needs dealing with now or whether it can wait. But if you know somebody, you can judge.
Yeah. It's a bit like business in Guernsey. It's based on personal relationships.
Yeah.
Yeah. And it's easier to set those up and build those relationships on a small island. So that's a real positive for us.
But I think the other advantage is the patients as well. You know, when I worked in Leicester, I had no idea most of the time who was turning up, and I might see them for 3 or 6 months. Whereas in Guernsey, even as a consultant, I'm seeing people now that I saw, you know, and they say, oh, we've met you before, and you look through the notes, and there's an entry in the notes from sort of 10 or 15 years ago, and I may have seen them intermittently. And again, that you build those relationships, so you're not rotating through a consultant or a registrar or a junior who's only there for 3 or 4 months. You see the same person consistently, and I think that's reassuring for people with chronic health problems, that they're not going to be having to explain their problems to a new doctor every clinic visit, that it's the same face, because there's only one of me, if you like, in that, you know, in that speciality. So I provide stroke.
There's plenty of evidence as well that continuity of care improves people's quality and longevity of life. You know, Robbie, I mean, you've been seeing some of your patients for many
31 years, man and boy.
Yeah. So, multiple generations, and certainly when I sometimes come across your patients, that's something that they say that they're deeply fond of, and that's not something that we see much in other jurisdictions like the UK these days.
Yeah, there's very little churn of medical staff, and the patients are wonderful as well, I have to say that.
That's lovely. Just one quick final question to you all. How did you find Guernsey's COVID response?
I think we used the size of the island to our advantage. And certainly I think that the collaboration with both primary, secondary care and with a public that were on board with the public health response, I think that's one of the reasons that Guernsey has become quite famous for its successful dealing with the pandemic.
We've got a very experienced public health team. We've got primary and secondary care working closely together, and we had political leadership. And also the communication with the people of Guernsey was very good. I think everybody came along because they were being spoken to in a very open way, and we understood what we had to do. So the impact in Guernsey has been perhaps a lot less than in other regions.
Fantastic. Thank you all so much. I really appreciate your insight and you giving time to talk about this. So ladies and gentlemen, please join us for other webinars in the Winter Virtual Events series, where we'll find out more about property in Guernsey, how easy it is to establish a business, and also for further information about immigration and residency. And if you need further information about anything we've discussed today, or for an initial conversation about the ease with which individuals and businesses can relocate to Guernsey, please contact the team at Locate Guernsey using the email address or phone numbers on the screen, and we'd be very happy to help. Thank you.